Mrs. T.E.S., a 47-year-old radiological technician, had severe rheumatoid arthritis. We treated her with ALA and LDN. She was not completely well. She was really sick. She went on Humira, which is a biological response modifier from a rheumatologist, and her lymph nodes increased in size. Many of these biological response modifiers turn off the immune system. So if somebody is prone to cancer, they can develop cancer from this. We did a PET scan, and it shows big lymph nodes in her groin and under her arms. And she was diagnosed as having a lymphoma from the drug. We took her off the Humira. We put her back on LDN. And this PET scan shows she still has the big lymph nodes. In April, by September of '09, they're gone. And this was a B-cell lymphoma. Mr. TM, I presented this case before, a B-cell lymphoma, biopsy proven at a big hospital in Chicago, 2004. I actually urged him to have standard therapy. He refused because he had been through other things before. A biopsy proven 2004 in Chicago. He only had 2 weeks of intravenous ALA. However, he continued his low-dose naltrexone at bedtime. He did not follow any of the other programs. In December 2005, big lymph nodes in his neck. This is backwards. Under his arms, here's the liver, that should be the right side. And a gigantic tumor, 2 tumors in his groin, his left groin. By May 2006, no sign of cancer. This is just accumulation of the contrast media in the digestive tract. The body's getting rid of that contrast medium. The patient did not continue therapy. He did not go to his oncologist. Lymph nodes under his jaw increased in size. He saw the oncologist, however, TM once more refused standard therapy. He started back on the ALA and the low-dose naltrexone. The groin lesion's gone. I don't know if this might be a lesion under his jaw. A patient not adherent to ALA and probably not taking his LDN. This is January of 2009. And guess what? The lymphoma's back. Well, this was published in 2007 in Integrative Cancer Therapies, Reversal of Signs and Symptoms of a B-cell lymphoma using only LDN. It was accepted in 2007. Mrs. DD had aggressive breast cancer. She was told she would die very soon. Nothing could be done. We treated her from August 2007 to present. And this is a graph from the laboratory, and it shows the various tumor markers in 2007 and where they are today. and they fell to practically nothing in 2 years. And she's still doing well. Her oncology folks said that she didn't have long to live in 2007, probably be dead within the year. She's back at work and doing fine. Well, I find that for cancer, a few people do very well, many don't. But LDN works really well for lupus and rheumatoid disorders. The standard treatment of autoimmune disease has some very serious adverse effects. Now, dermatomyositis is a very serious autoimmune disease. Presumably, the patient's T cells inappropriately recognize their muscle cells and skin cells as antigens and attack this tissue, causing degeneration. With dermatomyositis, there's often a rough, red, raised rash. And here you could see immune cells eating up the person's muscle. Here are the immune cells, and here's the muscle tissue. And their own body is destroying their own muscle tissue. The prognosis of this disease, 20% die in the first year. In chronic forms, people often live 2 to several years. These patients often have cancer, and this is a paraneoplastic syndrome. It's something that occurs in certain people with cancer. If you remove the cancer, sometimes the dermatomyositis disappears. Mr. W.J. had an extremely serious case of dermatomyositis. 48-year-old rancher from New Mexico. I first saw him in October of 2007. We did CAT scans. They did not show cancer. The problem started in fall of 2005, and he progressively became weaker, developed this horrible skin condition. When he came into the office, this fellow was about 6'4". He had to be carried in by his 2 sons. He couldn't even walk. The rheumatologist put him on prednisone, which is a steroid, Cellcept, which is a fungal toxin, which destroys part of the immune system. They often give this to people with transplants. Imuran methotrexate, originally a chemotherapy. Remicade, a biological response modifier. He kept getting sicker and sicker. His teeth fell out. He was a muscular man. He was losing muscle, a profound weakness, and severe anemia. His doctor told him he probably would not live that year. He would die within a year. He went to a big medical center, and they agreed with his doctor. Nothing could be done. His CK, when I saw him, which is the creatinine kinase, which is a marker, a test for that shows muscle degeneration, was 2,573 units per liter. His pain scale was 10. He was in constant pain. This was in October 2007. He was told he would die by Christmas, and he didn't want to be there. He was dragged in by his family. December of 2007, off his standard drugs and on our protocol, his creatinine kinase fell from 2,573 to 573. And his pain scale fell from 10 to 2. He was feeling normal. He was back at work as a rancher. In 2008, 12 months later, his pain scale was 0, and his creatinine kinase fell from 2,573 to 100,